We have two outstanding training opportunities for those fellows that are interested in our program. The first is in surgical critical care, which is a one-year training program. You will spend half of your training time in our surgical ICU as well as our trauma ICU, with opportunities to rotate through the burn ICU, the cardiothoracic ICU, the neuro ICU, as well as our vascular thoracic ICU, which contains our ECMO patients. In our second training year, which is our acute care surgery fellowship training, you will spend 1 year working with the trauma and acute care surgeons here. You will then have opportunity to work with our vascular surgeons as well as our thoracic surgeons. There's ample time for electives, both during your first as well as your second training year.
The critical care organization was embraced by all the surgical intensive care units here at the University of Florida to really improve the quality, cost effectiveness, and efficiency of the ICUs here at the University of Florida. Each one of these ICUs is at least 24 beds, and as we are a quaternary care center, takes care of these sickest patients in the Southeast.
So the culture at UF Health, the Department of Surgery, and this division of trauma and acute care surgery is one of surgeons that work very hard. They're very invested in their work and serious about it. They work together and do a great job, and it's always patient-centered. We focus on fixing problems that are going to make life better for our patients and their caregivers, and they do an excellent job. They do world-class work, and one of the reasons for that is that we have folks working together across divisions, across departments, multidisciplinary efforts, across academic ranks, and they do exceptional work.
It's an extremely enriching and nurturing environment, and I believe that we really work well together as a collaborative group. That's why our critical care organization was able to be established, because each department respects and treats each other with dignity and is really interested in one thing, and that's the best outcome for their patients.
We have a great relationship with our trainees. In critical care, you will be trained by not only surgeon intensivists, but as well as anesthesia intensivists, emergency medicine intensivists, as well as pulmonary intensivists. We have a dedicated curriculum for education in critical care, which is very multidisciplinary, and it's focused at the fellow level. In your acute care surgery training year, we have a system of basically graduated autonomy during that training year, where you basically work your path from being dependent to becoming independent. Overall, the training experience here will make you a well-rounded acute care surgeon.